the slides here, right? The first thing is, it's been almost 16 years that have been part of the integral part of the healthcare system, and since last 6 years, so I've taken an initiative to empower PU students, PU science students, to choose their career pathways. Why 6 years? Because because on during 2016 was when the NEET came into existence for the first time, and the entire the admissions for the MBBS completely changed, and from there onwards, every year there was different changes which has happened, and it's been very confusing for medical common people to understand what's happening in the background. And of course, a lot of changes in the medical, even for the MBBS itself, but still for the PU student, there's been a lot of changes from 2016, right? And we have been continuously being part of this. And I've been taking multiple training programs across Karnataka, basically for multiple students in PU colleges, right? So, and with that all vast experience, we have written a book on medical career guidance, both for complete on NEET as a subject, and for the UGs, and also what are the medical career pathways, not only medical, what else they can do as a science students, and if they don't get in India, what else options in abroad. Okay, so that's a basic background of credibility, where I'm coming from, so that I can give you information on this particular topic. So before we go ahead and discuss the entire topic of medical career pathways, so I would like to know, please comment in the chat box if you're live now, and once this complete session has been recorded and it's hosted in the YouTube later on, so you can please comment on the YouTube link, like the comment box, so that we interact with that questions and give you appropriate answers. So now please put your questions. What questions do you have in your mind regarding the entire after PU, what after PU, what is the career pathways, right? So some key questions, if you can type in a chat box, so that I can address that very specifically. Okay, so I'm just looking for some questions if they are coming up here, right? So okay, right, so good. So there are some questions which are coming up, and let me take that as we go on. Great, please keep on asking questions here, so that I'll address as once I addressed most of the questions during the presentation. If I have not addressed those, then I'll address your questions as when we go. Okay, right. So with that, let me move on to the next slide. Okay, so I know that you would have come here with some teacher telling and something else. So I'd like to know what is the current mood you're in. You're watching through a mobile, sitting somewhere. I understand you may be okay, I just wanted to see what is it happening, and you come here. Just type in the chat box 1, 2, 3, 4, anything. Just randomly you can just type. Okay, so that I get an idea that okay, this is the mood you're there in, and so that let me see at the end of the session will I be able to elevate that mood to the next level. Okay, so you can just type in the chat box 1, 2, 3, whatever the number you're coming at. Okay, 3, great. So someone is telling, okay, someone is very happy. Hopefully I'll keep you happy at the end of the session and not bore you out or disappoint you at the end of the session. Right. So with that, let's go ahead with our next. Okay, so coming to medical field, and it's a very jam-packed session because we don't, it's a 45 minutes session. That's what I have been given the time slot. So let me see as much as possible I can cover during this entire session. Okay, so with that, let's see why, what's medical field? Why medical field, right? Why to choose medical field? Why not get into engineering or anything which you're taken already science subjects? So the prime reasons what I can give now is, one is it, of course, everyone sees it as a noble profession, right? Second thing, it's a basic need of the society. So there is no recession in healthcare. Okay, every time, everyone requires a support in healthcare, right? And at present, with the growing population, we have a lot of shortage of medical professionals across global. Not only India, of course, the Indian population is growing, and a lot of things are happening, but still there is huge deficiency of doctors or any healthcare professionals. So if you look into the WHO, what is WHO? World Health Organizations. So they give a standard of we're giving at least one doctor for 400 population, right? So currently in India, we have 1:1,700. That means we require still more doctors. right? If you heard with the Dr. Devi Shetty speaking in the in media and many other stalwarts in healthcare speaking, they're telling like increase the seats of MBBS and also PGs in India itself, so that we can train our own students from India and put them into the public, so that there is healthcare services hands sufficient enough to take care, right? Okay, so coming to medical field, why medical field? Of course, it's a global profession. You can study in India or anywhere and then practice in any part of the globe if you have the skills to practice, right? Now coming to MBBS abroad, because that's a specific topic what has been asked me to talk about, because that's an area where I continuously keep working and upgrading our work in that particular area. So now coming to MBBS abroad, okay, it's a very tricky question, right? No, when you tell abroad, again there is a lot of resistance, like no, not abroad, in India. Okay, so with that, let me first give you an information on Indian scenario, what's happening in India. And of course, before going abroad, of course, in India, we are very much concerned and very attached to our families. So we would not just so easily get out into the global scenario and go easily and study there. And that also, if it's someone's daughter, then sending a daughter abroad becomes a very key issue. And they also look into many of the aspects, right? Safety is one of it, and sending so far, and all those things. And of course, with technology, things have made us closer, but still there is some resistance to send people abroad or go abroad. That also in the undergraduate level, okay, because still you are learning, right? So with that, let's understand the first Indian scenario, and then we will look into the abroad scenario, what can be done, right? So if possible, if you can choose the Indian scenario itself and not only medical, we'll see how it can be done. Right. So first, let's into medical. So first thing is, when you look into the medical healthcare, so 12th standard is a point where you look back and see what I have done for so many years and studied for 12 years, and now what is future next, right? There is a huge question. Okay, so now how do you look into that? And of course, when you come to science 12th, one either you go become an engineer or you become a doctor, right? It's not so that's easy, right? So we have multiple options as of now in healthcare, right? So just to give a scenario, so just imagine you are a patient, like you have some cough, cold, or some chest pain or any issues, right? You go to the hospital. As soon as you go to hospital, of course you meet a doctor, right? You meet a doctor, then you consult him, and doctor will tell you to do some investigations. You go to the lab, there is some people who will help to get the blood, analyze the blood, and then you also require some investigations on further on radiology, x-ray, and further things, right? Scans, and then again there are people in scan centers who do that, right? And there is operation theater, and doctor has only two hands, right? A doctor cannot alone do the entire operation, right? It's a team of people. There are at least 5 to 10 to 20 people who assist in the operation theater, either in the front of the scene or the back of the scene, for the successful operation to happen. So again, doctor is not the single person there. So there are multiple people there. And again, after the entire healthcare of the person is done, now again there's a recovery process. Again, there is a healthcare person who is involved in this particular process. At the end of the entire thing, we have a happy, healthy patient who comes out of the hospital, right? So that's not only a credit to the doctor, it's a teamwork. There's a lot of people on the front of the screen and behind the screen who are working towards the best interest of the patient, right? And not only being, and of course, doctor forms the leader of the team, he leads the entire team, but not only the leader of the team, you can also choose to become the entire, one of the member of the entire team, right? So that also we'll be discussing very shortly, so that we'll be getting more insight into around more than 30 career pathways, what you can take after your PU science subject, right? So looking into 12 years of hard work, what is next, right? Everyone, even the parents, even the students, everyone has that question, what is next? Right. So with that, and of course, you look for the advice, tips, assistance, guidance. But what happens? You go to your friends, you go to your relatives, you go to someone whom you know will ask questions. And as you ask questions, you have questions, you ask questions. But instead of resolving those questions, your questions become more bigger and more confusing, because they give their own opinions on about the MBBS or in India or in abroad or any of the issues, right? So whom to talk to about these type of issues, right? If you want to become a scientist who want to work in NASA or something, so you need to talk to a person who has already done it and who has been there, right? You cannot ask someone who has not done it telling that, okay, I want to join NASA as a scientist, right? Because, or Google as a technical person there. But if you ask someone else, oh, it's difficult, it's too technical, I cannot do it, like you cannot do it, that's what I was going to tell. So you talk to people who have that expertise, who have done it, so they will tell you how the actual path is it and how easily you can achieve it with what right steps, by taking what right steps. Okay, so so always when you're talking about your career pathways, even for MBBS students or even for the PU students, or even after MBBS, talk to the consultants, talk to the people who have done it, and then you'll get a right idea on what can be done. Okay, so the persons who have already done it are the right person to give you the advice. Don't ask anyone who have not done it about, if you go and ask me, how is it no, computer engineering is better or mechanical engineering or civil engineering, I don't have any idea, right? I cannot give you right advice because I'm not from that field. I don't know what are the pros and cons there. But if you can ask about healthcare, yes, I'm eligible to do that, right? So that's the point which is very important to understand. Next, right, as a science students, what are the options do you have? Of course, every career pathway is chosen by entrance exams, right? So now there are two tests in India what you can write, that is NEET exam and CET exam. So coming to the NEET exams, as you all know, NEET exams, what are the admissions? Because it changed, right? From 2016 it changed and kept on adding more number of courses to NEET entrance, right? Again, in this year, in 2021, there are more courses which has been added to NEET exam for the career pathways. Okay, so we'll just look into that. Of course, you know MBBS, you know BTS, Ayush has been part of it always. But again, in 2017, there were some changes which happened. Again, the what do you call it, as veterinary science, some of the seats has been moved to the NEET also, right? And then in year 2021, this year, there was a new notice from the NTA telling that BSc Nursing and BSc Life Science also is part of now NEET. Okay, you can get admissions, BSc Life Science, BSc Nursing also through the NEET exams. So this is again new addition. Maybe next year again some more courses will be added. Right. So this is just for information here. So you also have now BSc Nursing and also BSc Healthcare. Right. So interesting image. I understand, right? So when it comes to NEET exam, so how do I see, how do it looks for me, right? Because we also had a NEET in the PG, but not in the UG because we are not part of that. But how does it look? It looks like a war, right? And you are expected to win that war to get a seat. Okay, that's correct, right? And you are not just fighting against one opponent, right? There are so many lakhs of students from across the India who are fighting, you have to fight against to get that seat and get that success, right? So now, who is that opponent, right? So if you're Bahubali, who is the opponent? It is 16 lakh students. Like, so for example, if you already written your exams in the last year, that is 2021. So if you know, there were 16 lakh students who wrote the NEET UG exams, right? In 11 different languages, in 546 centers, in 155 cities for 88,000 MBBS seats. And if you look into some other seat matrix, like, if you look into BDS, there are 27,000. In MBBS, as per 21 statistics, around 83,000. So total 110,000 seats. And if you add other seats, like we have added MBBS, BDS, Ayush, and BSc, veterinary science, and now other seats, totally we have 160,000 seats. Totally, not only MBBS I'm talking. MBBS we are around 83,000, right? But totally we have 160 lakhs seats. And if you put as a funnel, right, we have 16 lakh students who are writing exam, and at the end of the day, how much of good you are done, like, whatever the best marks you're taken out of 720, even if you made 600 marks or 650 marks, only 160 people will be able to get the seats. right? And almost like 14 lakh students are without the seats of medical who aspire to become MBBS or any of the healthcare professional. Okay, so we have 14,000 students who are left back, who go for different other programs. But now we need to address these students also, because that's a huge people who are left back of not having a seat, right? So now looking into 160 seats again, is it like are you able to get all those things, right? No, it's only competition between India. No, we have around 15% of quota reserved for abroad, right? Students who are studying, who are from abroad, NRIs, non-resident of India, can also come to India and write exams, and they also have to take 50% of that particular chunk, right? So total is 1,60,000 seats are what is required, and then again there is 15% of all India quota which gets out of that 1,60,000. Okay, that is around 7.5 ST, 15% of SC, OBG, sorry, OBC, and general merit. Okay, so again 15% it went reservation for NRIs, 15% it went for all India quota, right? Then whatever is left is for the state. So out of 16 lakh students who appeared for NEET, again at the start of the NEET results announced, 8 lakh students will go off because they're not eligible even to get the passing marks of NEET. Okay, that means almost 50% of the students will fail in NEET. Okay, they will fail in NEET, right? So again, the competition is on, because our entire organization is basically now basically we are talking about Karnataka. I'm just giving one of the states. If you are from other states, great. You can look into the, but almost the same scenario. So we have around 18 government colleges, 3,100 seats, private 42 colleges, around 5,000 seats, total around 9,000 seats. So there are very lakhs of students who are competing, and even within Karnataka, that's how it is. And even though if you get a seat, right, again there is, it's not that okay, if there are 9,000 seats or 1,83,000 medical seats, still there is a competition, right? There is still a competition when it comes to finance. That is, if you get a government seat in a government college, you may have to pay around 59,000 per year as a fees. But if you get a government seat in a private college, right, it will be around 1,41,000 per year, right? But if you get a private seat in private college, it will start from around 9 lakhs. It starts from around 9 lakhs. And of course, a management or an NRI seat is around 30 to 60 lakhs per year. So this is the huge the finance of the medical seats in India. So that becomes a huge competition. First of all, we have a huge around 16 lakh students who are writing exam. Out of 16 lakhs, we have only 83,000 MBBS seats. Out of 83 MBBS seats, again, there are very less number of government seats for which you can take 69,000, 59,000 as a fees. And then you have very less government seat in private colleges. Again, reservation is less, 1,41,000. But the major share is about the private seats in the private colleges, which is 9 lakhs above, and that becomes difficult, not affordable for everyone to take this particular seat, right? And of course, NRIs is completely an executive class, and that's not out of the discussion here. Okay, now, and what are the numbers which are mentioned now with the fees, right? So it increases every year by 10%. Okay, right? Every year it increases by 10%. Okay, so management fees are expensive, right? You cannot, it's very expensive. If you look into some of the colleges in Karnataka, so these are the numbers of management seats. Okay, if you look into management seats here, right now, around 33 lakhs per year, 36 lakhs per year, 40 lakhs per year, 28 lakhs per year, 40 lakhs per year, insane numbers, right? So again, there's a huge competition, as you can see. There's a huge competition on this particular concepts, also management fees, right? So that's a huge thing. So we just looked into what is the current scenario of NEET in India, right? Of course, very good. If you're doing very well, you have got a very good rank and you're getting a seat in a government college, get wonderful, you take that. It's a wonderful opportunity. Congratulations on that. And if you're able to afford a private seat, great, please go ahead. But if you're not, then it becomes a worrisome, because we have only 83,000 seats, right? And we have 16 lakh students who want the seats. and almost 7 lakh, 8 lakh students who didn't pass NEET. So what is the next option which you can take in India itself is go to CET. Okay, so when you go to appear to CET, what will happen? So I just have some comments. I'll just, so can you elaborate on the last slide? And some other comments are there. So I'll address the comments later on, but you will also get more. I'll also give you a link to the next session, which is more elaborate, which you can go and look into there and then ask questions on this. Okay, so let's go ahead with the slides. So coming to the CET, so right, so once you have an option of NEET, great. If you got the seat, great. But if you didn't get the seat in NEET, please don't get disheartened, because it's the way the entire system has been prepared, right? For out of 83, we cannot push 16 lakhs into the system, right? It has to be filled with only 83,000. The rest you can also concentrate on NEET exam. So now, why NEET and CET, and what are the different career pathways which you can choose? Which most often, even being in the being a doctor, we got to know about these type of career pathways were available only when we finished our MBBS. Okay, so till then we were also not aware of these type of courses were available and very simple and easy to get into, and a good lifestyle and good pay at the end of the entire courses, right? So just look into what are the courses now. So some of the courses are one of the very, because it's called that soon, in maybe by 2030, 25 almost, or by 2030, India is gonna have a silver tsunami. Okay, it's a very popular term, silver tsunami. What do you mean by silver tsunami? That means by 2030, India will be having huge number of elderly population. So if you, I'm not sure if you know the population pyramid. So in Indian population pyramid is something like this, where the middle is wider. So this wider is the youth is more. So by in next 10 years, this wide youth is going to become old, and that's how the pyramid, the old people will be more in India, and it becomes narrow because of the family planning and all other COVID calamities. The number of youngsters would come down, and more elder people. If the more elder people, more problems in healthcare, more problem in healthcare. Of course, every person is having back pain, shoulder pain, all those things. So physiotherapy is one of the best choices of where you can take alternative in medical. Okay, and pharma, and every patient requires drugs, right? There are two ways of looking into pharma: B pharma and D pharma. If you're very much interested in research and something into more detail into research, you can look into B pharma, and something you have medical stores everywhere. You require a license for that, and you can get into D pharma in that particular case, right? And there's a lot of paramedical programs and allied health programs. So some of which are BSc in anesthesia. Anesthesia and operation theater technologies, right? Where we require a lot of, as I told, doctor has only two hands, right? So we need multiple hands in operation theater, and it doesn't come with so easily. It requires a lot of skill training in the same line of medical. But of course, you can easily get into these subjects and be side to side, shoulder to shoulder to the doctors, and help them in the entire process. Okay, there is something automated where they help in the eye doctor to handle the cases. There is respiratory cases, as with the COVID, you understood a lot of respiratory issues were there. So there are a lot of specialized areas of respiratory care which a person can get into. There is a lot of kidney issues. People are drinking day and night and partying, and later, of course, these are the advanced type of diseases which you're gonna get as we go on. So you require a lot of dialysis centers and laboratories everywhere, right? As you see, if you open your newspaper every day, you'll get a flyer telling get so much of discount for your blood test and whole body checkups. So huge process in that particular sector. Let me just, okay. So imaging is one of the thing. I'll just skip faster. So public health, as you understood, public health was a great importance in the COVID, where more detail of, and also global importance. If you finish public health, you can get into UNICEF, WHO, and other healthcare processes. Cardiac technology, as you know, the myocardial infarction, the heart attack has been increasing in youngsters currently, and there's a lot of things which can be done with the cardiac technology or perfusion, and neuroscience, radiotherapy, prosthetics, limbs, veterinary, of course, and also administration. So now with a lot of healthcare people and a lot of multiple hospitals, corporates, mid-size, small-size hospitals, we require administrative skills. which is required, right? So not only doctors can run the show, we need administration who knows healthcare to run the show of the entire hospital. So that's where you can be part of the entire healthcare system as an administrative section. Right. So these are some of the, just to give an idea. So it's not that every time you need to look into abroad as an option, right? So you can also look into within India what options are there, and then look into why abroad. If it's a actual calling that you need to be an MBBS doctor. Okay. If not, there are multiple situations which, you not choose to be a doctor, right? And you want to choose to be someone else. There are multiple things which you need to look into your characters and your core identity, and then get into this particular process. Okay, so now we discussed the entire thing. So I'm putting up the entire flow here, so you can see that the entire flow here, where we can see we just discussed. After second PU, you appear for the NEET, you qualify for the NEET. If you get rank, great, get into MBBS, BDS, Ayush, veterinary, BSc nursing, and other life sciences. But if you are not qualified in the NEET, then you can repeat NEET coaching, which is a controversial. You need to see what scores are there and then take a step there. Or you can join allied health science courses either through CET, which we discussed all of the different courses. Some of the courses, there are many more which you can add. Either you can through CET, or you can also directly get into management and take also these seats. Okay, because this is also very affordable cost. There are many courses which can provide you these type of seats. Right. So the question is, what if you are not able to get, and if you are looking to only MBBS as a option, and if you're not able to, you qualified in the NEET, but you didn't get a rank which is able to get a seat, then what's the option, right? What can be done, right? So the only option, if you don't get an MBBS seat through NEET in India, through a rank, and if you're not able to pay the affordable fees for even the private colleges or for the NRI, then the only option which you have is to go abroad, right? And when it comes to MBBS abroad, you don't have to look it as an alien topic. So it's been ages that people have gone abroad and done MBBS and come back to India. So only that, because you are not part of that particular community, you're not heard of it. So for us, almost like every 10th person who has been MBBS is someone who has done from abroad. Okay, in our community of doctors currently, even for MBBS and even for the postgraduates. Right. So now let's look into the MBBS abroad concept. Okay. So please keep asking questions, because as at the end of the entire session, I'll just go through the questions and answer those questions. And of course, you can ask live there also. But still, please keep asking questions there. Okay. So now let's look at the MBBS abroad. So let me see how many of you are actually interested in looking into MBBS abroad. Right. Just click. So just type in the chat box if you're interested in MBBS abroad. Right. Just type abroad. Just type abroad, so that I know that you are participating in the entire discussion. Just type abroad. And if you're watching the recorded session, please show your interest in the comment box in the YouTube channel that abroad. Okay, great. So there's someone called Goti, last name is interested in abroad. Great. And yeah, some more, and I'll discuss that. Right. So now looking to coming to the MBBS abroad. Of course, when I did my MBBS, I was not at all aware of there was something like MBBS abroad, right? And yes, someone is asking for PG. Yes, we'll discuss that too. Let me see my, yeah. So when I did my MBBS, I was not at all aware of that we could do MBBS in neighbor countries, right? Even till I finished my MBBS, that is since 2010, I was not aware that we could do MBBS in abroad. So when was it? Like once I finished my MBBS, and then I was doing my post graduation, and of course I was very active in post graduation studies. I had to travel abroad and do a lot of presentation skills and some talks and things because of the area of where I was working. So I had an opportunity to go at different universities in abroad and present my talks and informations. So one of the universities when I went abroad, that was actually I had been to one of the universities in abroad. I could see there were 500 Indian students in a single campus in one college. 500 Indian students studying there. Okay, and it was really amazing to see so many students studying there, and we had no clue that students were studying in abroad. Okay, and then I came back and explored on different opportunities and different countries where you can do our MBBS in abroad countries, and what are the opportunities, how is it, what are the things. And then I started talking to these different agencies who are doing these admissions and universities by themselves, how they are conducting these things and how is India regulating this particular structure. And then it was very interesting to understand that there are many destinations, across the globe where Indian students can go and do MBBS, and is approved by Medical Council of India and also approved by the World Health Organization to be a doctor. Okay, right. Now, coming to the eligibility criteria to do MBBS in abroad. Like who can do? Not everyone can do MBBS in abroad. It's only those who have qualified in the NEET. That is, those who only had passing score in the NEET are eligible to do MBBS in abroad. Okay, if you're not having NEET qualification, you cannot do MBBS in abroad. Okay, so when just there's a small trick here. So that means, yes, if your eligibility, what Indian government says, the Medical Council of India, now it is NMC. Okay, so in what NMC says, that the governing body says is that, yes, if you want to come, you can do MBBS in abroad, any of the countries which they have listed in their website, NMC website, and then come back to India to practice in India. You should have qualified in NEET to do that. Right? If you're not qualified in the NEET, and if you went to, for example, Philippines and did your MBBS there, then you can come back to India, but you don't have license to practice in India, but you can practice in Philippines, right? But of course, having said that, you need to have eligibility in NEET to come back to India and get your license to practice in India. Okay, right. So now coming to universities, why study MBBS in abroad? And because first thing is finance. Okay, financially, the cost of these seats are very less, right? It's very subsidized cost. Why? Because most of the universities in abroad is are government-owned universities, and they have a huge history of no more than 100 years. Just a minute, my mouse just moved. Yeah. Okay, so yeah, so there are more than 100 years of histories of who can do the universities histories, right? So first is the finance, that is around 2 lakhs to 4 lakhs is the fee structure. Okay, I not put as the what is the it's in rupees, right? It's 2 lakhs to 4 lakhs rupees. The fees for the colleges, and these are, most of them are government-owned colleges, and the teaching is in English medium. Okay, and specifically it's in English medium, and of course you need to look for those, for the most of the colleges are in English medium itself, and you have to look specifically for those and inquire with the particular authorities if it is English, right? But it is in English medium, and there is no specific entrance exam for most of the abroad colleges for the MBBS admissions. Okay, except in the Philippines there are some, and some universities there are, but most of the colleges there are no admissions. Your admissions is done directly based on your PU marks and entrance or NEET scores. Okay, and for each campus, and these are not colleges, right? We don't call it as a college. These are all universities. Standalone universities are huge universities with more than 20,000 students studying in one campus. Okay, huge universities, right? And coming to India, yes. Once you have the certificate to study MBBS, once you have the admission letter from any of the colleges, you can get loans in India also with the Indian banks. Okay, so now, okay, so now, what about the colleges abroad, right? So there are more than 500 medical colleges which are approved by the Medical Council of India. I'm talking about the previous organization because that's the previous last statistics. okay, to study MBBS abroad. It's been approved by the government of India and Medical Council of India, right? That you can study the MBBS abroad. Okay, right. So now let me go to the next slide. Right. So what are the destinations? Of course, these are just few destinations which are put. So popularly people from India were traveling to China, but because of the current relationship, there is some controversial things, either to go to China or not to go to China, and a lot of things, right? But however, that was one of the population destination. But now next popular destination are three currently. No, I can tell four. One is Philippines, because it's native English speaking, so most of the students are going to Philippines. But there is a tricky thing of how the entire admission happens. The next is Russia, Ukraine. Yes, these are different countries with different languages, but the entire studies are done in English language itself. But if you want to study, for example, if you're thinking, okay, I need to go to Russia and I have to learn Russian language. If I go to Ukraine, I have to learn Ukrainian. So what will happen? So something like that. Right, let me tell you. So if you're in India and if you're from if you're from Delhi, you're from I don't know, Mumbai, your native speaking language is Hindi, right? And if you come down to Karnataka to get an admission, that is either through an all India seat or the payment seat, NIS seat, if you come to Karnataka, you need to learn language, because your profession is completely based on the language, right? Your profession is completely based on the language. If you cannot speak the language what people speak here, you will not be able to communicate. So language anywhere in the world, if you are staying in that particular country or with that particular region, like in Karnataka or Kerala or Tamil Nadu or anywhere in the space, you need to, space means I mean to tell the earth itself, you need to know the local languages, right? So but however, your entire studies, writing exams, everything will be done in English languages. But you require, of course, there is training for in Russia and Ukraine and other colleges, wherever there are training given for first year to learn the local languages. They will train, you'll have exams also to write it, but basic things you can. And however, you need to go to your at least the store to buy a chocolate, you need to know the language, right? And you have to climb a bus and take a travel, or go to a train and take a travel, you need to know the language. And if you want to go to internet, even internet is in different language, so you need to know the internet. So that's automatically within 1 year the students are able to comprehend and follow with the language. So knowledge is not a barrier, it becomes a key skill, which it's an advantage of having one more language and one more country to you as an at the end of 5 years, 6 years, you'll be able to have a lot of friends from those countries. Yeah. So now let me just rush through some of the colleges. Of course, there are, as I mentioned, there are 500 plus colleges across the globe. So I'll just simply, I'm not telling these are specific colleges, but I'm just giving some examples so that we just cover those topics. So in Russia, there's one of the universities called as Farson Federal University. This is the entire campus. This is a university. There are more than 25,000 students staying in this particular university, right? It's not only having MBBS, it has engineering, it has bioscience, it has life science, it has every subject. Okay, it is a university, right? And this entire campus, you have hostels here, you have your hotels and cafeterias, everything within the system, right? And even there are buses within the campus to travel for one place to other places, right? This is how the classes system. This is a library of that same college. This is the entire campus where you can travel. You need to have, most probably they'll use the bicycles to travel around, and the classrooms, and that those are some stuffs in Russia. That's how it is. And of course, there are times when it goes negative, minus temperature. There is snowing also in this Russian and Ukrainian countries. Kharkiv National University, one of the good universities. You can see some of the Indian and other vernacular subjects. Philippines, we have different students. China, of course, it's one of the controversial now, but yes, they have huge, big colleges. Georgia, again, one of the native European countries where they speak English. It's also one of the popular thing now, coming up with multiple new universities also coming up in Georgia for the admissions. And coming to admissions, these admissions are very channelized, very strict, because these are all government colleges. You get a before you go to the colleges, you get a letter of admission, and then all the fees for next 5 to 6 years, whatever the country which you choose. Not every country is having 5 years. As in India, it is 5.5 years of MBBS, right? In Ukraine and Russia, it is around 6 years of MBBS. In Philippines, it's around 5 years MBBS. So like that, different colleges it changes. You need to look into that. And of course, once you finish your MBBS in abroad, when you come back to India, currently we have something called as a Foreign Medical Graduate Exam, FMG exam. It's an entrance test, screening test done for the benefit, so that we screen and we get good students who have the knowledge to give license to them to practice in India. Okay, so now this scenario is going to change. Hopefully next year or the next year there is something called as exit exam, right? Exit exam which is going to come, which has to be written by even the medical students of India and also medical students of abroad. Okay, so this FMJ will be gone, and there will be one exam of exit to test the knowledge of a medical student. Is he eligible to get license to practice in India or not? Even if he is done in India, or even if he has done his studies in abroad of any colleges. So any college in India or abroad, you have to write exit exam and then do an internship here in India, and then get your license to practice in India or do your post graduation. Okay, so these are the this is the next flow of MBBS abroad. That is, if you're looking into PU exams, as we discussed, if you can see my mouse here. So we have undergraduate NEET qualified. If you're qualified in NEET, rank in NEET, and if you get a good seat, then you can take a seat in MBBS in India. If you're not if you're qualified but not got a rank in India, then you can go to MBBS in abroad. So you can choose China, Russia, Ukraine, Malaysia, Philippines, Kazakhstan, Georgia, and Caribbean Caribbean island is also available. But there are some each country has its pros and cons, so kindly check with that before you go ahead and do the admissions. Okay, so now I think I completed most of the things which I had to inform you, and let me take some question answers there. And also I have some, if you don't have specific questions, I'll also go through my list of questions which we have discussed. So I think before I address that, I'll go to my list of questions, so that most of the FAQs, so by presenting more than 30,000 students from across Karnataka, I have a lot of questions already set it down, so that we answer those questions first. Where is it? Yeah. So how to do MBBS after 12th and NEET, I already mentioned. Okay, that is covered. What if student cannot get MBBS through NEET? Yes, if you did not get MBBS through NEET, if you're able to, if you're past NEET, then you can go abroad and do MBBS. Okay, which are the countries can do MBBS? Of course, as per India, currently people are, and Bangalore or Karnataka, people are most preferring for Philippines, and then Russia, Ukraine, Georgia are the countries where more people are preferring, and these are also economically better countries where you can do MBBS. How much is the fee for MBBS abroad? As it starts from around 2 lakhs, but if you look at a very good college, decent college, it's around 3 to 4.5 lakhs is the fees, and maybe around 1 lakh extra for your hostel and for your expenses per year. Okay, and how much would be living expenses? It's around 1 lakh per year would be the living expenses in abroad. You can take it as 1 lakh. Okay, how many years it takes to complete MBBS in abroad? As I mentioned, it depends on the country. So somewhere ranges. In India, it is around 5.5 years, 5.5 years. Okay, and in abroad, it's around 6 years, and in some countries, it's around 5 years. Okay, and of course we have to come back to India and do an internship. That is a new rule, which is by next year I think we'll get to know what's going to happen with those changes with the exit exam and compulsory internship and all the things, right? So do bank give loans for the studying MBBS abroad? Yes, they give around 80% of the fees amount, which is printed with your admission letter. The banks can give you the loans. Okay, is it secure to study MBBS in abroad for girls and boys? Right, very wonderful questions. I think these are, and the thing is, yes, it is secure. Of course, you need to check before you enter, because there are multiple things. One is, for example, one of the university in Ukraine of Russia has an camera, which is all the CC cameras of the university is live on YouTube 24/7, 365 days. right? You can see the entire campus, of course, not the entire inside the rooms, but into the campus. It's 24/7 live in the YouTube. You can, if you are having your son or daughter in that country, you can watch the campus, what's happening in those countries, right? Second thing is, of course, everyone gets a swipe card, and it's more advanced when you go abroad, right? They have swipe cards where you can swipe. You have to swipe for every entry. Like, if you want to enter your hostel room, you need to have the card to enter the hostel room, right? It's electronic. So like that, there are a lot of things, and of course, local embassy you have to register, local police you have to register, and every names will be registered there. So what about the language while doing MBBS abroad? I also mentioned that. Is there any difference between MBBS syllabus in India and abroad? Yes. Of course, there was very dramatically in Indian syllabus and abroad syllabus, because abroad syllabus was more advanced, and these countries had more in par with US syllabuses, right? In Philippines, it's completely US syllabus. Georgia, it's US syllabus. Ukraine and Philippines, Ukraine and Russia are more of UK-based syllabus pattern. But India had a very old system, and just 2 years back, the India, after I think 20 years of its continuous being in the same syllabus, has changed the entire pattern of medical syllabus and the way education system in medical is going to happen, right? And it's towards a good line. But I'm telling, this has been already followed in abroad countries before our India has taken the steps. In that time, we are also in par with them. So of course, MBBS teaching standards is par with India. Yes, it's par with India, and there are a lot of already micro and micro teachings is happening with small group teaching. Everything is already, and skill lab and skill mannequins. Everything is already there, and this system is already applied there. In India, we have just started 2 years back. What about food and climate and doing MBBS in abroad? Yes, food, of course, you get a lot of local foods, and people who have, there have been 5, 10, 20 years that students from India are going. So there are a lot of hotels from Indian parents who are doing there. That also is there, and also home services, hostel services, and also you'll get foods that is there. And of course, there are multi cuisines. Climate, yes, that's one of the things. In some countries, there are minus degrees. Of course, it's part of your journey where you have that. And if you're very much allergic to the temperature, they can look into temperate climate countries like Philippines and some other countries which you can look into. What we study MBBS can apply in Indian patient. Yes, it can be applied. Whatever you study in any part of the world, you can apply for any patient because you're studying on the humans. Yeah, so do MBBS degree from abroad countries are recognized to practice in India? Yes, it is practiced. As I mentioned, it is allowed by the Government of India and Medical Council of India. Okay, and World Health Organization. It is recognized. You can practice as a legal practitioner in India. No difference between India and abroad students. Okay, so you can get a job in India. Yes, even you can get a government jobs, and a lot of students have done good and working as in government places. What is the right path? Of course, you need to get through an agency, because they will handhold you in the entire process, because it's a completely different country. So you need to have an agency to back you up to get the entire admissions. So do you also give guidance on post-graduate courses? Yes, we do give guidance on post-graduate courses, which is a separate session which you have platform, if you can look into that. And yeah, there is less passing marks in FMG, because it was very long back when we didn't have that criteria of NEET, right? Once the NEET came into existence, that is in 2016, right? NEET came into existence, that they have to pass NEET to get MBBS seat in abroad. Before that, even the 40% student or 35% marks who were passed in PU can go to abroad and get the things done, right? Just a minute, let me check if everything is there, right? Yeah. So before that, that was the scenario. So that's why the passing percent score is very less. Before 2016 batches. Now 2016 batches started. So now after 5 years, right? So 21 now, next year, right? Next year onwards, the new batch who are actually eligible, who have done well in the exams, have taken the seats. And from next year onwards, you can see the passing percentage would be a great percentage, because people are how the screening has happened, and the good students have got admissions in abroad. How to connect for medical career guidance? Yes, I'll also give you a link. You can also get the link in the description in the YouTube, or also in the chat box. I'll put it up in the next due course. So what happens at the end of the day? You get a seat in. You do your NEET. If you don't get a seat in NEET, go to choose a seat in CET. If you didn't get a seat in CET, then the option is abroad. For those really looking for MBBS abroad, right? So what to do after the exams? So basically you need to know your options, right? Know what we just discussed is just knowing your options, and you need to clear your doubts. Of course, we don't have much time to clear doubts here, and I have some questions in my chat box. I'll address that. And then you should know the practicality of each career field, right? So if you finish your no particular multiple career pathways, look, so can I work in metro cities, can I work in my village, can I make my life in no, should I go to Delhi itself to get a lifestyle and job there? So a lot of things comes into action, right? So then you need to contact the experts for any guidance. That's what I have mentioned, who is an expert, right? And that's how it is. And it looks like a maze with a lot of confusion, a lot of twisted turns, but don't worry, there are a lot of process. You can visit medicalcareerguidance.in. It's a neutral platform where you can get guidance and see what are the options available for you, specifically customized, and then approach different agencies who are actually doing direct admissions, and you're not going through third-party agencies. And then so you can choose the right agencies through them and understand what can be done. Okay, so at the end, live your dreams, get out there, the world is waiting, make wonderful career pathways, don't get afraid of any of things. Everything is a learning process, everything is a challenge, and you'll come out of the challenges with a great color, flying colors. Right. Hopefully, I have given a lot of insights, and because of the short time, I had to bit rush and speak a bit faster. But all this entire session is also available in the YouTube. Will be, I think, you'll be watching YouTube, and also there's a link below in the description for and more detail, because it's a very short duration. We have a more detailed training program which is already in our platform, where you can watch that in more detail with more information. Okay, and just if you could type in the chat box, I can get any feedback, so I'll know how we have done, and see if there is have altered the mood, and if you got a positive experience at the end of this entire 45 minute session. So just type in the chat box 1, 2, 3, 4, or 5, and let me see if there is. Oh, great. Okay, thank you so much. Right. So with that, just let me give some information. Right. So that's not the end of the journey. There is a huge ocean after MBBS. So we just touched a very small part here on the top of this MBBS abroad bar, right? Once you finish there, this is the huge process to finish your career pathway, not to be an expert in medical field and become an postgraduate doctor and as consultant specialist in India. There are a lot of things which you can discuss. So of course, before getting into that, you also should know how many years it takes for you to complete the entire thing, right? So with that also, we also have made a very huge package of what can be done after MBBS and how the life of a specialist is. So what we have done, we have spoken to around 50 plus consultant doctors from across India, and we have packed that of more than 40-50 hours of content into a jam-packed pack, where you can get an idea on how a consultant's life is and what career pathways can you choose. So you can just visit drsajjanacademy.com and you'll get the entire for the MBBS abroad package. And of course, the book is available. These are the index of the book. With all the details. In more details, we look into here MBBS in Ukraine, Philippines, Malaysia, more details specific with all the names of the universities. We put in the book. You can get them in the Amazon, but we're also giving it for free. If you go to medicalcareerguidance.in website, where you can see there is a master class. The entire class, what I mentioned, it's very brief, but in more detailed information with each specific things, we have put in that entire video training program. And along with that, at the end of the training program, you'll get that entire book for free as the ebook, which you can download and look into that. Okay, so if anything is there, you can just contact this number. One of the technical person from backend will able to take this and help you in from the medical career guidance platform about this. And these are the links which will be put in the description. You can click on these links to get your free ebook, get the entire detailed training, and also like any consultation require any consultation from the medicalcareerguidance.in platform, you can apply there. And also for abroad after MBBS, if you require any help, please you can also click on the third option on after MBBS and other informations, right? So this is our follow link. You can follow us on these platforms. In any of the Dr. Sajjan Academy, that's where it's mainly for our platform is mainly for healthcare professionals who are doing MBBS or completed MBBS, or in any other healthcare professionals who would like to upgrade their skills. I'm not talking about the knowledge you already have. We are working on the skill-based training platform. We have multiple skills where you can get skills, either hands-on skills or theoretical skills with workbooks and things where you can upgrade your skills. So that's the platform. Would like to see you there, maybe if you're getting into MBBS later. And thank you so much. So before that, let me just see if there are any specific questions which I have not addressed out of the entire process.
Good evening, sir.
Yeah, good evening.
I'm Priya from Core. So we have one person on our team who is actually doing her first year MBBS at Philippines, and she would like to share her experience.
Wonderful.
As well.
Yeah. Please.
Simran, you there?
Hello.
Yeah, hi Simran.
Yeah. Good evening, sir.
Yeah, you're from which college?
UV Gilias College of Medicine, Cebu City.
Oh, UGILA. Okay. So I think that currently in Philippines, UGILA is open for admissions. So
yeah, like we have admissions for first years there currently.
Yes. Go ahead, Simran. Please share that.
Like we need to do the BS for 1.5 years over there, and once we complete, we are like need to give an NMAT exam, that is Medical National Admission Test. So once we get a good percentile over there, there's not a percentage considered, like they consider a percentile. So if you get like around 50 percentile, you can get admissions like in many colleges, but for our college it's around 75 percentile, so you can get an admission for in first year MD. Then we have like our classes from morning 8 to like in the evening 7 p.m. So it's like the whole day they take practicals, and then we are sent out to practice or just to help out in the hospital, so we can gain some experiences for like to how to help or how to like what you can say, how you can help out the patients. So we just get like sort of an idea. So over there. And for the exams, we are like getting a monthly exams, like per month we are having exams for every subject. Subjects are little bit different from India, but the syllabus are like slightly changed, and it's like you get more subjects to study, and you have specific topics for it. Like for we have like different topic like epidemiology. We specially study that subject, or research. Anything you can research over. You need to go and roam around the city, like then access what the research you are doing, and then you need to present it. I think that's it.
Okay, great. So Simran, you're in which year now?
I'm first year student.
You're a first year student. Okay, great.
Yeah.
So wonderful to hear from you, and it adds a lot of value for the people who are watching this in the YouTube or live, to hear someone from Philippines. You're basically from which place? You're from India?
I'm from Pune, Maharashtra, sir.
Pune, Maharashtra. Great, wonderful.
Yeah.
Great. So anyone else is there other than that? Okay. Right, great. No, that. Okay, got that. So yeah, so as Simon said, Philippines has a bit different admission process. There is an BSc which has to be done, and then there is an NMAT exam, and then it has to go through. Yeah. So any specific questions which are not touched on are there in the chat box? So can you elaborate on this last slide? Yeah. So all these slides and more detailed information is there. I have put the link, and also it's there in the YouTube. If you're watching, is recorded in the chat description down. So the entire thing has been more graphically explained, and more information is also present in that particular section. PLAB is much better than qualifying next. Okay, so right, someone is commenting on the PLAB exam, and someone also mentioned on USMLE, I suppose. Yes, residency at USA and Canada. See, whatever we just talked about abroad, right? So where you cannot get admissions. You cannot get, I'm not telling you cannot, but it's we're not preferring US, we're not preferring UK, we're not preferring Australia, we're not preferring New Zealand, we're not preferring Ireland. So these are the countries which has very specific process of admissions for MBBS, right? So we are talking someone who are not got rank in NEET and looking to an alternative solution with financial stability. So those are the countries which we discuss. So why we discuss these countries is, of course, financially very expensive. Second, for example, if you want to get an MBBS admission in US, you need to have finished your second PU and 4 years of graduation and then get your MBBS seat. Okay, there's a different process itself on each country, and there are a lot of things. It's not just getting an admission. So we didn't discuss on US, UK, Australia, New Zealand, Ireland. Okay, so these are the countries. There are specific process which is not so easy to get into and financially very challenging. Okay, so that we didn't discuss. Residency in US, that is not part of this. Right. How easy or difficult is it to study MBBS abroad to continue higher studies coming back to India? So how easy or difficult to study MBBS abroad and coming back to India and doing higher studies? Yeah, it's basically you're doing your MBBS. It's so I think as Simran was telling, she was telling different topics. Their subjects are a little bit different, but topics are same. The way they have placed in the next duration of 5 years would have been different. Like, they may have, she mentioned about epidemiology, she mentioned of research in first year of MBBS, which is not done in India, right? But now with the new syllabus which has come in the last year, yes, we have incorporated those topics in India. But till then, we didn't have epidemiology and research because this is part of community medicine subject, which comes in the third year of MBBS. So like that, at the end of 5 years or 6 years, you will complete all the subjects and you will be ready to write your exams in India or qualify in India. Right. Opinion USMLE for old medical. Okay. So I think there are some questions for post MBBS. I think that will not part of this discussion. You can go to the medical career guidance after MBBS topic, which I put a link there. You can get more information there for that. Right. I think that with that, I think let me complete. And thank you so much for all the audience for being here live on the Zoom. Thank you for your patience. Thank you for the time. And those are watching on the YouTube recorded, thank you for your time and going through the entire process. And wish I would see you on the other side in our Dr.Sajjan Academy platform, which is mainly for the medical students and the other doctors. So thank you. And thank you, White Army. Thank you, Kishan, a very good friend of mine, for giving this platform and giving an audience to speak about MBBS career after PU MBBS career pathways, right? And thank you so much for the organizers for hosting me today. Yes.
Oh, yeah. Thank you so much, sir. It was truly an informative session. And actually, there are so many anxious students and even more anxious parents with so many questions and no clue on whom to approach. Actually, your session and guidance today will be giving them a clarity and better understanding of the whole process, sir. And thank you very much for joining us for today's session, sir. So we need your guidance and support throughout.
Sure. My pleasure always.
And I take an immense pleasure to thank those who have joined via Zoom and YouTube. And if you have any queries, you can reach out our mail. It will be put in the description. And thank you, everyone. Have a nice day.
Thank you. Bye. Take care.